Okay. It's like that. Is it a right or a left? And how do you tell?
Is it
It's a left.
right?
Based on what?
Based on the curve.
Okay, but you could have curve this way. That's right.
Yeah. Is it because this is connected to the vertebral? And
That's not what you look for. That is correct.
Mm-hmm.
But what you look for is the easiest thing. You see that? That's the intercostal groove. The costal groove where the nerve, the artery, and the vein go. You see that? You're looking at the inferior surface, which means this is a left. Even if it's turned this way. So it looks right. It's the inferior surface. So it actually goes this way. Okay? See, we were looking at the top here. And you're right, it's a left, but it's not going to be that easy on the test. It's going to be like that. And what I want you to look for is that. And if you don't see it, okay, then you're right, it's a left. You're correct, it's a right. Okay? And yes, this is posterior. Okay, this is the articulation for the thoracic vertebra. Left or right, how do I tell? Male, female, how do I tell? Okay, first of all, you look for the ischial tuberosity, okay, which is your pseudopod, which means it's like this. So it's real obvious then, right? It's the left. Okay? No matter which way it's going to be, if you're sitting on that, this flare comes out this way, that's medial. The other thing you look for is the auricular process. Okay, so this is a left. And because the acetabulum is there, it's the left side. Okay. True pelvis down here, this false pelvis up here, and you can see the line. Right or left, and how do I know?
It's the left.
Correct. Why?
That's the sternal end.
Mm-hmm. But couldn't it go this way? Are we looking at superior or inferior, first of all? Establish that first. What are you looking at?
That's superior.
That's inferior. See how messy it is?
Yeah.
That's where all the ligaments that hold it to the rib and everything else. So it's going like this. So that's correct. And then once you know that, then yeah, this is the medial. That's the acromial limb. The flat one, the flat spoon part, is the acromial limb. So once you know that, but it could be this way, it could be this way, it could be this way. If you see the ugly stuff, okay, you know you're looking at the inferior. All right? That's still going to be the acromial end. This is still, this funky thing is still, but you could say, oh, it could be this way. No. The other way you tell, forward first. That's how I remember it. Forward first. Okay, so that's an easy, stupid way to remember. Forward first. Now, if it's like this, you're looking at the bottom, the inferior portion, you go, okay, I got to flip it over. It's going forward first. So it's a left. Left or right? How do I know?
That is left.
Correct. Why?
This
That
is
is
on
the medial
inside.
malleolus. Right. It's your ankle bone. It's always going to be on the medial side, except when it's turned like this. But you already know that that's backward because look over here. And it doesn't look right. It's like, whoa, there's something wrong with this bone. There isn't. It's just the posterior surface. So if you're looking at the anterior surface, looking at it this way, you know, okay, that's still going to be medial. Okay, so it's still the left. And if you have to do like this, you know, go ahead if it helps you. Okay.
But we can't touch the.
No, you can't touch the bones. You can't turn them over. So you'd have to go, okay. What is it?
Radius.
Try again. Look, there's a U.
Oh,
Oh,
sorry.
no.
Dead giveaway. Oh no, big U. Okay. Lacrinon process. Coronary process. Sorry. Is it left or right? Now remember, anatomical position. This is always hard for people. Anatomical position. What's the outer bone? You're going to radiate joy. Radiate. It's the radius.
Radius is on that side.
Okay, so that's the medial bone. So what you look at for here is first you look for the U to tell you it's the ulna, and then you look for the facet for the articular head. And that's always going to be lateral because the radiating bone is lateral. Okay, your flying bone is lateral. Okay, so if you don't see that in here, you see it on that side, it tells you it's a left. Everybody see that? It's going to be here. Because my radius would sit there. Okay. Again, these are all stupid. You know, the U. Can't get away from that. Okay, I'm going to make this really hard. First of all, what bones?
Tibia.
You sure? You kind of guess that. Yes, this is the tibia. I heard somebody say tibia, but somebody said the tibia. Now, this is just so stupid that most people laugh when I do this. But the way I tell the right from the left is I put my pointer finger at the point. This is proximal, this is distal. So I look at the distance. You will not be able to touch it, but put your pointer finger right over the point, the right finger, by the way, don't make it your left. And if you see bone on the left side, it's a right. Does everybody see that? If you see bone on the left side, it's a right. And it has to be your right finger, because if I go to the left and I see bone on the right side, it's a left. Whatever bone is sticking out on whichever side, my right and my left, see, it's the opposite one. So it's sticking out on the right side, it's a left. It's sticking out on the left side, it's a right. So just go ahead and do this in the middle of the test. Okay, yeah, okay. It's on the right side, that means to the left. It's on the left side, it means the right. Whatever the opposite is. Okay. Radius, right or left. All right, remember, it's your lateral bone. Okay, these lateral bones are always hard. So,
Right?
you're correct. Why?
Isn't this the
That-
radial notch?
This is where, yeah, this is the radius, and this is where actually the biceps. And see that outer, my thumb? See down here, my styloid process? Okay, you know that this is pointing medially. Okay, first of all, and that's going to be lateral. Okay, so if I can put my thumb there like this, my thumb is sticking out, and that's going in. That's how I tell. Oops, no, it's not a left. Okay? Just like my elbow is sticking this way. Okay, because we're dealing with the ulna there. So that's why I think of it. Okay, my elbow's sticking that way, and my thumb is sticking out. It's a right.
What if it's like this way?
Well, then you're looking at backwards, aren't you? Well, then you have to figure it out. You have to go like this. Now it's actually easier for me
Can you do that?
because you just did like that. Okay. Just remember, this is going to be medial. So if it's sticking out that way, it doesn't stick out that way. So you're looking at the posterior aspect. You also have to make sure you're looking correctly here, in the way this looks, and the way. See how this is much smoother here? Okay. Then you're looking at the correct anatomical position, the anterior portion of the bone. If it's not smooth, you're looking at the posterior portion. Okay. But that's still your wrist, the big honker one. Okay. So for me, where my elbow is and where I'm sticking out, okay, it's right. I'm looking at the back of it. See, I'm looking at the back. Because this is not anatomical position. This is backwards. It's a right. Okay, remember anatomical position is this way. What is it? Okay, now this is easy for me to tell. You look for like the triangle shape. Okay. And see where it's big on this side? There's a big side and a little side for the facets. The big side, I'm looking at the triangle bottom. Big facets on the right, it's a right. Now, ooh, nasty. Look again at the triangle from the anatomical position now. You see where the round is? The round is always lateral. See how it's pointy here? And it's round here? The round is always lateral. So once again, you're looking at a right. Okay? Round. Lateral is a right. Okay. These are so easy.
The humerus.
It's a humerus. Which one, right or left? And how do I know?
Left.
No, it's right.
This one.
It's because of this.
Big.
Yeah, you look for the head
Yeah.
first. That's your big indication. That's going to be going medially. Then the next place you look is down here. And if it looks like that,
Yeah.
you're looking at the posterior aspect.
Mhm.
That's the olecranon fossa,
Mhm.
where the olecranon process of the elbow goes. So that's backwards. So you go, okay, it's right. If you have to, in the middle of the test, do it this way,
Mhm.
okay? If it's this way, it's easy. Oh, guess what? It's my right.
Yeah.
Okay. You're also looking for the trochanters and the biceps tendon groove. Yeah. Spine of the scapula, supraspinatus fossa, infraspinatus fossa. Is it right or left?
It's gonna be right.
Correct. You look for the big dip, and that's the bottom. Okay. This is the articulation for the clavicle, acromion. That's the glenoid fossa.
Mhm.
Okay. You're looking at it from this way. Yeah, you're gonna have to
Yeah.
go.
Yeah.
Right.
Yeah.
And just do it
Yeah.
if it helps you.
So if it was like this, and you just look at this.
That way, it's easy. You just lean forward and go, okay, it's right.
Yeah. Yeah.
All right?
Mhm.
Okay. You guys are done. Oh,
What
you're not.
about the atlas and
The atlas, nothing else looks like it.
the
It can't be anything else but. Look at it.
thoracic?
Look at it.
Yeah.
That's the atlas. I can't find the thing that has just the bones,
Mhm.
just the vertebral column. Nothing else looks like it. You see, there's no body. There's no body in this atlas. The body is actually the dens of the axis.
Mhm.
Okay, nothing, no vertebra looks like the axis. All of these guys, see this hole? See that hole? There's a hole here too. All cervical vertebrae have that hole. All of them. Okay? It's the vertebral foramen for the vertebral artery, which only appears in the neck. Okay? So that's going to be a cervical. A thoracic vertebra is going to have an articular facet for a rib. Now, once I'm through with this, guys, I'm going to let you go. You can either study or you can teach this to other people, which would be really good. When you have to teach, you really learn. Okay. Now, this is a mean question, but it's absolutely fair. Look at these two vertebrae here. Of course they're not. And they're broken. First of all, superior articular facet faces away from the body. The inferior articular facet faces toward the body. Okay? Now, here's your nasty question. Which is this, thoracic or lumbar? This one.
Lumbar.
No. Why? You see that? They all have an articular facet. When they're a thoracic rib, or a thoracic vertebra, they have an articulation, a facet for the rib. This one that I was showing, see, there's nothing down here. They're also big. It's probably likely, but I would ask a question like that. Okay, these are lumbar. See the difference? Now look. There's your thoracic. Do you see? You see on the body? Everybody see that?
Mhm.
These two are lumbar. That's not.
Mhm.
So it's due to this?
It's to this facet right here.
Oh, okay.
The facet for the rib, articulation with the rib. This is broken. Hoping it's better on the other side. No, of course not. It's broken. These are so badly damaged. See that? See that?
You don't have the sharp thing.
Transverse process. It's not called a sharp thing. Okay. It's a transverse process. Oh, these are so badly damaged. Yeah, there's an articular facet. As you go up farther, see there's these two. As you go farther, the vertebrae, they articulate with two ribs. As you get down toward the bottom, they only articulate with one.